All right, ladies and gentlemen, I am Colonel Tom Sherman, proud commander of the 88th Air Base Wing and installation commander for Wright-Patterson. Wright-Patterson family, I apologize. We had a level of bandwidth issue that we were dealing with, and the feedback that got to us is that you were maybe hearing something about every 15 seconds. So what I want to do is I want to back up a little bit, kind of start again from the beginning, regroup, kind of summarize the issues that I spoke about before, and hopefully get a chance that we can get this message out to you tonight. So first off, what I wanted to do was thank the Wright-Patterson family for joining us again at another one of our town hall events. These are so important to us, and we hope that they're important to you as well as we share this information. What I'd first like to start off by giving a couple kudos here and really kind of have the opportunity to thank our Community Support Coordination Cell team members that have really gelled together over the last week, and they have really come together in helping to look at what does community support look like across Wright-Patterson. And in doing so, one of the things that we've actually done, and today it was just a great remark of the efforts they're putting in, is that we were able to deliver meals and we were able to deliver care packages to our Wright-Patterson healthcare professionals at our medical center here. And it was a great testament to the support that the community and the base has for people that are putting in such an amazing amount of work to take care of all of us. So I want to thank the team for doing that right now, and I want to thank all of you for your support to all of us. The efforts that we've been making as far as people adhering to our requirements on utilizing facial coverings going into the public gathering areas, thank you up front for that. It has been paying some great dividends, and everybody has been doing a phenomenal job on adhering to the requirements that we're asking of all of you to do. We've seen some great work by people on developing their facial coverings, but we've seen great attitudes from people as they're participating in it. So thank you. It is making a difference. As we go through, I kind of want to give you a status of where we're at right now. As you most likely saw in Governor DeWine's press conference earlier today, as we're looking at across Ohio, what does the immediate future look like for us? And I'll tell you, at Wright-Patterson Air Force Base, we are planning for the surge. We have still got ourselves focused as we're watching the COVID-19 infection numbers rise. We are still planning on how do we as the installation react, respond, and what are the changes that we may need to make according to. What I want to tell you up front is that we're seeing that the investments that all of us made early on and the investments that all of you made early on are making a difference. So we feel very well prepared as we're going into this surge that we'll be able to manage the situation along with our partners across the state of Ohio. But I will tell you that we are evaluating every day what are the aspects on what services may or may not have to be reduced? What are aspects on the installation that we may have to draw back from? Do we have to reduce our footprint even more to really base essential and emergency essential personnel? So all of those are being done daily, and I will tell you that the evaluation is taking place near time. As from the Department of Defense standpoint, some of you may have heard that the stop movement order has been extended until the 30th of June. That standpoint is an effort to protect our force and to protect our people. They still want to keep all of the protocols of the stop movement in place. But the Secretary of Defense announced today that they're going to evaluate this every 2 weeks and make determinations whether they need to increase it or decrease it based on what COVID-19 is doing across the country. So just wanted to let you all know that we're monitoring that as well. Furthermore, the things that we're also looking at is what is the new normal and what does sustainment look like for Wright-Patterson? We received a number of questions over the course of this week kind of coming into us asking, do we know what the end date is? When can we start returning to normal? When can we come back to work on our offices? And I will tell you, we are evaluating that on a daily basis. And right now, the virus hasn't changed. The virus is still working its way through. We're still watching the numbers. But in that being said, what we want to do is make sure that we need to combat to the greatest extent possible is that we don't want this to make a resurgence. So what we're asking for all of you is we're asking for patience. So when we look at returning to what a new normal might look like, when we look at ceremonies and so forth, each of those are being evaluated in a very phased approach. So the promise that I make of you is that our teams are actually in the process of planning, and we have a phenomenal Incident Command Center team right now. As we've stood up under the Incident Command System, we have got a team of experts and subject matter personnel that are diligently working daily across the installation on what does this mean. And so the phases may come through over a long period of time, but we'll gradually get ourselves returned to what we think is our new level of operations. And that new level of operations may see things as increased telework becoming a part of our lexicon now. It may see us, at least initially, increasing and maintaining social distance at ceremonies. We may still have limitations on the amount of personnel that can participate, but I assure you we're working on all of these pieces. When it comes to the ordering of personal protection, sanitizing wipes, hand sanitizer, and so forth, our incredible team in our logistics center and our hospital are working together to make sure that we're going to manage that system as we return back into the new normal. As a case in point, the Defense Logistics Agency has regionalized all of their contracts, and they are right now soliciting from installations on what are our requirements for face coverings and masks for our employees. And I'll tell you right now, our logistics team and our experts are working through that right now, getting the information back from our mission commanders, and we are submitting that to the Defense Logistics Agency to make sure that our requirements are in the queue as well. So hopefully that at least paints a picture of the things that we're looking at and kind of giving you a status of the installation right now. What I'd like to do is hand it off now to Colonel Michael Fouch, our 88th Medical Group Commander, to give you an update from the medical group.
Thanks, sir. I appreciate that. Good evening, Wright-Pat. Again, I'm Colonel Mike Fouch. I'm the 88th Medical Group Commander. I want to talk to you a little bit about the preparations that are going on at the 88th Medical Group, and also some things that we are working through in order to continue to help you. So our installation commander, Colonel Sherman, talked about both ends of the spectrum, really. He talked about what could happen in terms of a surge, and he talked about what could happen in terms of a new normal. We're watching the data on a daily basis to try and understand where we are in that climb or that plateau. And really what we have to tell you is it's too soon to understand exactly where we are. We're really looking at needing at least another 7 to 10 days of data to understand where are we in this particular phase of the issue. So when we talk about surge planning, we talked a lot about that last week. And the efforts that you have taken to heart, the guidance that our installation commander has put out, the guidance that we've seen from the state of Ohio has really helped us to gain valuable time to make those planning efforts happen. So the opportunity to understand how many beds are available, how many supplies we have, to build a little bit of a stockpile of supplies, if you will, cross-train our staff, and be ready for a potential surge has been invaluable. And I can't thank you enough for the efforts you've taken to make sure that we had the time to appropriately plan and take care of you. On the other end of the spectrum, what happens if all of those efforts have been extremely successful and we've flattened the curve the way we wanted to? What we could see is somewhat of a long new normal in terms of small cases of positives, at least for our team, over the coming months. And so what that may look like and discussing when can we return to work and how we can return to work, part of that scenario really it falls on our commanders and our supervisors in making sure you can help us make sure your staff is safe when you return to work. Right? So it's all those things in working through proper social distancing, wearing face coverings when you come to work, hand sanitizers, appropriate numbers of staff continuing to telework if they can. Those things, and supervisors working through how they can help their team stay safe, are incredibly important. So will we return to where we were more than a month ago? Probably not. And so what we need to think about is, what does that new normal look like as we when the data allows us to make a decision to return to work. And most importantly, supervisors and commanders, continue to have your folks stay home when they're sick. That's incredibly important. So one thing that has been extremely helpful is the policy of our face coverings that's come out. And so I'd like you to know that your medical center is no different when it comes to the face coverings that we've put in place across the installation for public areas. And so beginning on Friday, all patients and visitors to the Wright-Patterson Medical Center will be required to wear a face covering when they visit the facility. Any of the same cloth items are acceptable when you come to the facility that you're wearing on other parts of the installation, as long as they're clean, functional, and they cover your mouth and nose. Our staff will also be wearing face coverings, surgical masks, and the proper N92, N95 protection when they are dealing with either possible or confirmed COVID positive patients. And I appreciate your support as we work through and implement those guidance across the installation and also at the Wright-Patterson Medical Center. Additionally, we've had many people ask us if they could volunteer. And so I'm greatly supportive and appreciative of all the efforts that have come forward to help us with requesting volunteers and with putting forth time. And so the 88th, we have created a new process for medical volunteers offering their assistance toward the COVID-19 response. We are accepting volunteers that hold a current license or a national certification. And a volunteer may be military member, retiree, dependent, or civilian with a valid ID, but they need to be able to have access to the Wright-Patterson installation. There are some requirements that we have for registering and helping us with the credentials process for medical volunteers, and it's a copy of a government-issued ID, current license and certification, and we'll work through other documents that may be required. Our team is going to post a flyer to our Facebook page for those members who may be interested in volunteering at the medical center. And our Wright-Pat Medical Center volunteer coordinator is Captain Christina Knickerbocker. And we'll post her number and her email so that she can help provide information and gather the right documents for you. In addition, there's also a Wright-Pat Air Force Base non-medical volunteer coordinator, Miss Valerie Nagelson. And that information is going to be published probably right now by our team to the website and also after this concludes. At this point in time, the Wright-Pat Medical Center has not seen a huge increase in positive COVID patients, and so we are doing well with the staff we have. But as Colonel Sherman had mentioned, we are continuing to plan for a surge that may be on the horizon, and building that bench, building a pool of volunteers that may be able to help us is essential to us making it through this together. So I appreciate the opportunity to bring that forward tonight. Lastly, I just want to say thank you again for all the efforts that you've taken. I know this is not easy. The social distancing, the stay-at-home order, mask coverings, all the different rules that have been put in place. But I can tell you, we are seeing lower numbers than originally projected for our area and for our population, and I believe that is directly attributable to the efforts you've made to keep each other safe, to keep your family safe. So I want to say thank you for that, and I'd like to pass it off to my colleague, Colonel Paul Berger, our Mission Support Group Commander. Thank you.
Thanks, Mike. Good evening, ladies and gentlemen. As Colonel Fauch said, I'm Colonel Paul Berger, the 88th Mission Support Group Commander. Much of the conversation that we've had recently, particularly when I've been at the podium here, has been talking about a lot of the functions that, unfortunately, as a result of COVID-19, we've had to close down. But I do want to talk about one function that's still going on right now that is extremely important as it continues to serve the installation. Our Airmen and Family Readiness Center, led by Mr. Eric Thayer, is just an absolute incredible resource, and it is continuing to function, albeit with some workarounds, to support the men and women, the airmen and families, as the name implies, from our installation. As we speak, the team here is putting up some information in the comments section to provide contact information for the center should you need to reach out. So just to talk about some of the things that they continue to provide in the form of resources to our population. The Air Force Aid Society, they're continuing to screen customers and processing emergency loans per the guidelines that are there. Once the screening is complete, they meet face-to-face, again, per COVID-19 protocols, just to issue the checks and the finality part of the process there. The Transition Assistance Program, for those who are separating from our service. Life still goes on in that sense, and there are some statutory requirements that need to take place. So those are continuing to happen right now with some of the TAP modules, virtual TAP counseling, things like that. There is some direct and telephonic engagement with the staff right there. But again, if you are considering separating, or if you're at that point right now, understand that that mission is going to go forward. You just have to be patient with the way that it has to go forward right now. One very, very important part of the Airman Family Readiness Center is the Military and Family Life Consultant Counseling Services. The DoD did grant temporary dispensation to be able to have those MFLEX, as they're known, deliver counseling through virtual means, because obviously in times like this, face-to-face are just not able. So those resources are out there as well. Again, there's information on the website right now that can guide you to that should you need it. Relocation assistance, understanding that not much is moving right now. The Airmen and Family Readiness Center stands by to assist with that, both now for those of you who like to pre-plan, and then for the future as those assignments start to be dropped. As I said, right now there should be some information on the webpage. It's giving you some information as to how you can contact the Airmen and Family Readiness Center if you want. Changing gears just a little bit, I wanted to extend thanks for all of those of you who are wearing masks as you go about your business in the commissary. I know we've changed a few things there, requiring the mask to be worn. We've got the metered entry that requires you to wait for a period of time because we're limiting the number of people in the stores. The one-way aisles and some of the other things that have been put into place. Understand that we do that for your protection, but also for the protection of the workers in the commissary. They are there full-time to ensure that you have groceries to take back to your home, and by wearing the masks, as they are wearing as well, ensures that everybody is staying healthy and safe within that facility. Lastly, we are looking currently at the appropriate time when in consultation with some of our public health experts here, when it's deemed safe, we are looking to reopen some of the MWR activities that many of you have come to know and love throughout the Force Support Squadron. I don't have any details right now because so much really is dependent on the status of the virus and where that's at. But rest assured, we are looking at, as the weather gets nicer and those of you who like to get outside, we're looking at some options to, with a measured, graduated approach, get some of those things open and give you a chance to get out and about a little bit. With that, I'd like to hand this off to Colonel Lee, our Public Health Emergency Officer.
Thank you, Colonel Berger. Good evening, Team Wright-Pat family. I am Dr. Huiling Lee. I am the Chief of Aerospace Medicine and the Installation Public Health Emergency Officer. It's good to be with you this evening. Thank you for tuning in. I want to take a moment to talk to you a little bit about our Incident Command Center. This COVID-19 Incident Command Center was stood up by Colonel Sherman and the wing leadership solely for the purpose of managing this health emergency. So the team member that is on this Incident Command Center team consists of subject matter experts from medical, planning, logistics, finance, security forces, administration. So we have an outstanding team that is working very hard to make sure that we are monitoring the situations and working closely with our local partners and state and national partners to better handle this emergency. So having this team, it really enables this installation to better coordinate and manage the efforts and resources across all the organization on this base, as well as with our local partners and agencies. Now, there's been questions that ask, like, what triggers would result in ease of restriction? I think I think that's a very good question. As Colonel Sherman and Colonel Fauci alluded to earlier, we're going to make decisions based on medical science and good data, and the health and safety of you and the members that call Wright-Pat home, the safety and health is our #1 priority. So we're going to be, tracking the data very closely. We're monitoring the curve. It's great to see that because all the effort that you have put in, that the leadership have leaned forward on, that, we are seeing lower number and we are not outstripping our medical resources, and we are saving lives. So thank you very much for doing what you're doing there to help us flatten this curve. So at this point in time, the data is too early to tell. So we just ask for your patience, and hopefully in 1 to 2 weeks we'll have a better idea where we are. So thank you on that. And lastly, I just want to touch on another thing along the same topic, is what does the process of getting back to normal look like from a public health perspective? again, I think it's a question that many people are asking. It is not easy to continue to do the social distancing and to stay home, but it's something that is our best weapon in this war against this virus. So what does the process look like? So I would frame it this way. So, the vaccine, the drug companies are doing, working very hard to come to deliver a vaccine. However, that may be a long way off. So, another aspect of this too is spread testing, and we are, at this point in time, we still have a shortage in COVID-19 testing, and it is very important to be able to test, isolate, and contact trace to contain this virus and prevent its spread. So the things that we are doing, remains to be very important in this fight against this virus. And these are the public health measures that you heard many times before. It is the hand washing, it is the cleaning the high touch areas, it is wearing that mask to prevent the spread, and please stay home when you're sick. So it is so as we think about how we get back to going back to work and easing these restrictions, I would ask that commanders and supervisors think about what things that you would need to do in your workplace to help to provide that safe place for people to get back to work to, and the tactical things that need to be done to get to that point. Because as I say earlier, the vaccine is a little bit is a bit off. It's some time off, so it will take time. So that's what that's what I would like to say on that. And at this point in time, I would like to turn the mic over to Chief Abona.
Thank you, Dr. Lee. Good evening, everybody. My name is Chief Master Sergeant Steve Arbona, the Command Chief for the 88th Air Base Wing. And today I just want to talk to you a little bit about some questions and concerns that may have come up regarding Air Force professional military education. Specifically, are we still doing some of the training that we used to do? So that's a yes and a no. Some of the military training we used to conduct, such as Airman Leadership School and some other courses, have been temporarily suspended. However, Big Air Force has designated that several technical training phases 1, 2, and 3 courses still continue as they are mission essential. So we are working with those various technical schools to ensure that we safely receive these students, get them in processed, bedded down, and fed and transported to and from their schools as appropriate. Essentially what we're doing is taking care of our airmen like we do every other day. There are a couple of things that we are doing in addition to what we were previously doing due to this pandemic, and those include there's limited movement for these students, and that movement is kind of limited between their dormitories, the dining facility if it's applicable, and their classroom. And this is done for the first 14 or so days as they're assessing themselves to make sure they don't have any of the symptoms of the coronavirus. Also what we're doing is more frequent health, morale, and welfare checks are being conducted by our dormitory leaders, our military training liaisons, our first sergeants, our chiefs, commanders, leaders of all levels are making sure that they are paying closer attention to these folks. But in addition to the morale checks being conducted on our technical training students, we're also doing those increased morale, welfare, and health checks on our permanent party dormitory residents as well. Various levels of leadership and all of our helping agencies are going out there and making frequent contact with all our dormitory residents to make sure that, number one, they have everything they need, and number two, they know that we are still here for them to take care of them of all their needs, regardless of what they may be. But I would also like to mention that we fully understand that this virus doesn't discriminate, and no demographic is immune to any of the medical or psychological effects this pandemic may have on people. So it's imperative that we focus on all of our airmen, regardless of their military or marital status. And just as we take care of our technical training students and our permanent party students, or permanent party members rather, we also pay close attention to our single airmen, and especially those who are single parents. We must take care of them. Many of our single parents are out there, and some of them may not have any relief from the parental, domestic, as well as their professional duties that performing while at home. But with the schools closing, this exacerbated the problem, and many of them are now playing the roles of healthcare provider, daycare provider, educator, as they are teaching their own children what they would normally be learning in school due to the school closure. Again, no demographic is immune from the effects of the COVID-19, and it's imperative that as leaders, supervisors, wingmen, and just basic humans, that we take care of one another. So thank you all for your continued care and concern for all of our airmen. Stay healthy, stay informed, and stay connected. At this time, I'd like to turn it over to Colonel Sherman. Thank you.
Thank you, Chief. Really appreciate that solid message there. So as we have an opportunity to wrap up tonight, I know that we've had a few technical issues that have been going along with this, and I wanted to let you all know that we are going to be saving a clean copy of this on our Facebook page. They're recording it as we speak, and they're going to save a clean copy on this. It is one of the issues that we're dealing with our times, where people are using a variety of different platforms in which to share information. What that means is that we're competing for bandwidth on Facebook and our ability to get this Facebook Live out. We want to keep our town halls live, and so we may periodically experience some of these. So I just want to thank you all for your patience with this, but we will get a clean copy. What I'd also ask that you do is that if you've got questions, please type them to us. We'll go ahead and fill in the comments, and we'll be answering you throughout the evening and tomorrow like we've been doing for the weeks prior. What we'd also ask is that throughout the course of the week, if you've got questions or topics that you would like us to bring up in the town hall, please send them to us, because what we want to do is help to tailor our discussions so that it's meeting an important need that you have. So thank you all for that in advance, and thanks for your cooperation and appreciation tonight. As we kind of get a chance to conclude this evening, I want to leave you with just a couple messages on this. As we go through this, we are all learning together. We are experiencing together, and we are sharing what we know. Our biggest commitment to you is we want to make sure that we are combating misinformation. There is so much information out there, and some of it is misinformation, rumor, interpretation, or whatnot. And we want to make sure that we keep the communication lines with you open and keep these lines sharing as we learn how COVID-19 is affecting us as a people, affecting us as a base, and affecting us as a community. So just know that we're going to do that. Furthermore, as we are in the throes of this global pandemic, this is tough. And it is tough emotionally, and it is tough physically. And as you've heard from all of our subject matter experts, we have got an amazing net of helping agencies that are there for you. They are there to catch you. They are there to hold you up. They are there to sustain you physically, emotionally, and spiritually across the board. So I would continue to just push. Please, please utilize those helping agencies, because at the end of the day, if you raise your hand and say, hey, listen, I need a little help getting through this week, just know that there's going to be a hand out there to reach up and pull you up, because that's what we do as an Air Force family, and that's what we do as Team Wright-Patterson. As we conclude, I think really the word that really comes to me this week is grit. It is a raw word, but it speaks to this really basic human emotion of determination. It is that sense of determination and collective resolve in the long game, that we've got a goal that we're going to reach as a people, and that grit is going to drive us through here. So just know that we are seeing it in people across this installation, this sense of grit and determination that we are going to make it to the end goal, and we're going to be better as a result of it. I have an opportunity and a front row seat to see this grit in the men and women of the 88th Air Base Wing daily. And their determination and their belief in the end state that it's going to get better is truly sustaining folks across the installation. So what I would just say is that collectively, let's pool the power and the strength that our individual grit brings us, and just know that the stronger that we are together, the more resolve that we have, we are going to reach this end state, and we are going to be better than we were when we showed up. Just like we said, every day is going to get a little better, and we're going to get a little better every day. Thank you so much for joining us on this Facebook Live event and our town hall. We appreciate it sharing with you, and I could not be more proud than being associated with the Team Wright-Patterson family. We care so much about all of you, and it's our charge for you, and we can feel it in return that you care about us as well, and it means so much. We hope that you have a great rest of your week, healthy, happy, and safe, and we will join you again next week. Please keep those questions coming, and we're thinking about all of you. Take care, everyone.